So you did it. You survived hours in the dental chair and invested in some pretty delicate periodontal surgery. The absolute last thing you want is to mess up all that hard work with one tiny mistake, like, say, drinking through a straw. Okay, let's get into your game plan.
Right now, I'm guessing you're on your couch, your jaw is totally numb, you've got an ice pack handy, and you're staring at a sheet of post-op instructions that might as well be written in another language. Don't worry, we're going to translate all of that for you.
Think of this as your personal survival guide. Our mission is to explain the why behind all the what-to-dos, because as soon as things start making sense, the whole process becomes a lot less stressful. You know, from the moment you walked out of that clinic, the success of the surgery really shifted right onto your shoulders. Let's start with the first 48 hours. This is, without a doubt, the most critical window for your recovery, and it all boils down to managing two things: bleeding and swelling.
A little bit of oozing is totally normal, but what happens if you start to see some active bleeding? First, don't panic. Now, moist gauze is the standard advice, but there's an amazing solution you probably already have in your kitchen: a simple black tea bag.
The science on this is actually pretty cool. As you can see here, black tea is packed with these compounds called tannins. If you've ever had a dry red wine, you know that feeling. Well, tannins act as a powerful natural astringent. When they touch your tissue, they literally cause the blood vessels to shrink and help form a solid clot much faster.
So how do you use it? First, you steep the bag in boiling water, which just sanitizes it. Then, let it cool down so it's damp and warm, but not hot. Place it right on the site and apply firm, continuous pressure for a full 20 to 30 minutes. Now this is the most important part. Do not peek. Every time you pull it away to check, you're tearing apart that delicate little cloth that's trying to form.
Next up is swelling, and its timeline is totally counterintuitive. You'd expect it to be worst on day one, right? Actually, no. Swelling usually peaks on the second or even third day after surgery. This isn't a bad sign. It's your body's healing response kicking into high gear. It's completely normal.
So how do you manage it? Ice packs on the outside of your face. A good rhythm is 20 minutes on, 20 minutes off. Think of this as managing the local situation. And then you manage the bigger picture with gravity. When you sleep, prop your head up on 2 or 3 pillows. This helps drain all that excess fluid away from the site, and it makes a huge difference in reducing pain and puffiness.
Okay, now that we've stabilized the wound, let's talk about protecting it. The next challenge is to make sure you don't accidentally undo all that hard work. And honestly, this is where many people can unintentionally sabotage their own recovery.
The experts are crystal clear on this. You have to avoid creating suction in your mouth. That means no straws, no forceful spitting, and absolutely no smoking or vaping. We do these things so automatically that we just don't think about the mechanics of it.
And this analogy just nails it. That carefully formed blood clot is the biological scaffolding for your future gums. Creating negative pressure by using a straw is literally like yanking the plug out of a bathtub drain. You don't just cause bleeding, you rip out the entire foundation that your body needs to heal.
This brings us to a bit of a paradox. How do you keep the surgical site clean in what is basically the dirtiest environment in the human body without actually touching it? It's a real balancing act between hygiene and getting the fuel you need for healing.
The best way to think about it is this. You have freshly poured concrete in your mouth. You still need to brush your other teeth, that's like sweeping the porch, but you absolutely must not drag the toothbrush bristles across the wet cement of the surgical site.
Rinsing also follows a very strict protocol. On day 1, the day of your surgery, there is absolutely no rinsing. Stillness is the #1 priority. From day 2 onward, you can start gently rinsing with warm salt water. And I mean gently, don't swish. Just tip your head from side to side and let the liquid bathe the area. You're cleaning it chemically, not with physical force.
Your body also needs fuel. Stick to foods that are soft, lukewarm, and chemically neutral. This doesn't mean you're stuck with just protein shakes. You can have eggs, pasta, mashed potatoes. But you have to avoid the 4 threats: anything hot, spicy, crunchy, or acidic. Those can all cause renewed bleeding, intense pain, and inflammation.
Now for the pain. The gold standard is a dual strike of ibuprofen and acetaminophen. They work so well together because they attack pain through 2 completely different pathways. Ibuprofen works locally to shut down inflammation right in the gums, while acetaminophen works centrally, in your brain, to block the pain signals themselves. So the absolute key here is timing. You have to take your first dose before the anesthesia wears off. It's like building a roadblock before the train even leaves the station.
If you wait until you feel the pain, you're going to be trying to catch a runaway train, and you will suffer while the medication tries to catch up.
Even if you do everything right, human biology can be unpredictable. You need to know when it's time to stop being the do-it-yourself caretaker and bring the professionals back into the loop.
Here are the absolute red flags. You need to call your clinic if you have severe pain that the medication just can't touch, bleeding that won't stop after 30 minutes of firm pressure, swelling that is still getting worse after day 3, or any systemic signs like a fever or persistent nausea.
And finally, just remember that your mouth is connected to your entire body. Healing requires systemic calm. That means avoiding any strenuous activity that raises your blood pressure for at least a week, because that increased pressure can literally push against that delicate clot and cause it to fail.
And this brings me to a final thought. We know that physical stress raises blood pressure, but what about mental stress? Being anxious and worried spikes your heart rate just as effectively as going for a run. It's a fascinating reminder of that mind-body connection. So perhaps true recovery means you can't just rest your jaw, you have to rest your mind too.